Hello, and welcome to the University of Maryland School of Nursing Compliance Requirements Overview, brought to you by the Compliance Office. Compliance by Program. All BSN, MSNE, nurse anesthesia, and PhD students are required to complete the compliance requirements by the posted compliance deadline prior to your first semester. All DNP, excluding nurse anesthesia, RN to BSN, RN to MSN, master's, and certificate students will complete the requirements once you have registered for your first clinical, practicum, or project course in your program. All students enrolled in coursework only or solely online courses for the semester are exempt from the compliance requirements. EXAT account access. All BSN, MSNE, nurse anesthesia, and PhD accounts will be auto-created within 2 to 3 weeks after you have activated your umaryland.edu email address. You will receive an account activation email from EXAT to your umaryland.edu email address when your account is active. All other program accounts will be created by the Compliance Office once you have registered for your first clinical, practicum, or project course. You will receive an account activation email from EXAT to your umaryland.edu email address when your account is active. Next, we will review some standard compliance expenses that you can expect to pay during your program. Please note that this is not an exhaustive list of expenses. Additionally, students are responsible for any costs associated with compliance. The EXAT approved subscription is an annual $20 fee which covers the cost of the approved team reviewing your documents. The EXAT One clinical site onboarding fee is a one-time $40 fee per program, and it encompasses the clinical onboarding experience. The universal drug screening is $29. The universal background check is $54. The universal New York State background check is $108. Please note that the New York State background check is only required for students who have lived or worked in New York State within the past 7 years. We will now review what documentation will need to be submitted in order to complete each requirement.
For tetanus, you will submit documentation of your most recent tetanus shot from within the past 10 years. As tetanus renews every 10 years, you will only need to submit updated documentation if yours expires during your program. For the MMR, or measles, mumps, and rubella, you will submit documentation for either a 2-dose vaccination series or a positive titer result for each of the measles, mumps, and rubella. For varicella, you will also submit either a 2-dose vaccination series or a positive titer result. Please note that a history of disease is not an acceptable form of documentation for varicella.
For hepatitis B, you must submit a positive hepatitis B surface antibody titer. If you have documentation for a previous vaccine series, please submit them alongside your titer results. If you have not yet been vaccinated against hepatitis B, we recommend beginning the series as soon as possible, as it can take anywhere between 3 to 6 months to complete. For the flu, you will upload the current season's flu vaccine, which is due annually on October 1st. Students admitted for the spring semester will submit the current season's flu documentation by the posted compliance due date for that semester. You must submit updated flu vaccine documentation annually. For tuberculosis, you must submit tuberculosis test results that have been completed within the past 12 months. If you have a history of positive tuberculosis results, you must also provide a negative chest X-ray from within the past 5 years. During your program, you may need to provide updated tuberculosis test results at any point due to the needs of our clinical, practicum, or partner sites. Alongside your test results, you will also complete the annual tuberculosis risk screening questionnaire specific to your results. The tuberculosis screening questionnaire renews annually. For our BSN, MSNE, RN to BSN, and RN to MSN programs, we can only accept a QuantiFERON Gold tuberculosis test result. For all other programs, you may submit a one-step or two-step PPD skin test, a QuantiFERON Gold, or T-spot test results. Your background check and drug screening must be purchased and completed through the approved UMSM vendor via your Exact Compliance portal. These will be completed upon your first clinical and practicum experience in your program. Please note that you may need to provide updated background check or drug screen test results as needed per our clinical and practicum partner site requirements. To complete your drug screen, you must bring the lab slip issued through the approved UMSM vendor to either a LabCorp or Quest Diagnostics testing facility. We are unable to accept results completed outside of this process or purchased through an external vendor.
For CPR, it must be the Basic Life Support BLS certification for healthcare providers. We are unable to accept any other level or type of CPR certification. Due to the nature of our clinical and practicum partner site requirements, for our entry into practice programs, the BSN and MSNE, we can only accept a BLS certification certified by the American Heart Association. For all other programs, you may submit a BLS certification certified by either the American Heart Association or the American Red Cross. Please note that you will need to renew your CPR certification every 2 years. The Code of Conduct is a one-page document that you will read, then sign and date, and is available to you directly within your Exact Compliance portal. For the HIPAA verification, it includes a brief HIPAA PowerPoint presentation alongside a 2-page document that you will read and sign and date. This is also available directly in your Exact Compliance portal. Please note that you must upload both pages of the HIPAA document for approval. If you are in need of any medical or religious immunization exemptions, these are handled by our Student Health Center, and the forms are available in your Exact Compliance portal. While the University of Maryland may accept your medical or religious exemption requests, our clinical and practicum partner sites may not, based on their site requirements. Please note that there is no preferential placements for students that have medical or religious exemptions.
We have created the Compliance Self-Tracker, which is a great resource you can use to track and manage your compliance. It includes all of the information that we have reviewed in this video. You can download the Compliance Self-Tracker from the compliance website at www.nursing.umaryland.edu/compliance. If you have any questions regarding your compliance, please email your questions to nrscompliance@umaryland.edu. Please do not email us your compliance documents, as we want to keep your information confidential and secure. All documentations must be stored in Exact in order to be considered compliant.